I go back to about 1890 when my grandfather moved from Ashland, Nebraska to Houston, Texas. My grandfather was invited to come down with his family and become the general manager of the Houston Heights. And my grandfather played a very important and integral role in the development of the Heights to be one of the most prestigious residential sections of any place in the world. Grandfather stayed in his home there on Heights Boulevard until his passing, and I have many fond memories as a boy exploring all of the aspects of that area, and especially the big house in which my grandfather had his family. My father, I think, was going to enter the University of Texas at Austin and pursue a sort of a pre-medical or a pre-dental program there. My father had suffered from bronchial asthma since childhood. He developed a rather severe asthmatic attack and returned to Houston to recuperate. And after about a month, he had recovered here sufficiently and was considering going back to school, but his mother convinced him that that was not a wise thing to do, and she encouraged him to apply to the dental school, which had just recently been opened in Houston. He was encouraged, I'm sure, by his family that Houston was a very important metropolis and had a great future. He became a captain in the dental corps and was very fond of talking about some of his experiences in France. And we were his boys, and we were very proud of his military service. Well, it always seemed to me that his profession was his #1 priority. He had a schedule. He'd leave home every morning about 7:30 or 8 and go down to his practice and get home. And in the evening about 6:30, he wasn't one of these men who wants to go hunting or fishing and have all sorts of activities. His hobby really was his dental practice. He became an inventor. He invented a number of devices and methods of treatment that I think some of which have persisted to this day. I talked to many of my father's patients, and they said every time they went to my father's office, he spent so much time talking about my career, and he was so proud that I was at Johns Hopkins and doing all these things in my profession. And I think he was very proud of what I was doing. He wasn't altogether pleased because he didn't have someone to take over his dental practice. He'd always emphasized the importance of family accomplishment, and just the name Cooley to him was something that deserved promotion. I was fond of my father and I admired him. He was sort of my role model. He would be enormously proud of having this center there in his honor, and it would really please him greatly. I'm sure he'd love to have taken an active part in any activities in that center. Well, I think that we ought to all recognize the fact that our individual record was going to be forgotten, but what is going to continue is the institutions which we have helped to enlarge and create.